One other question always the patients ask me is, what is the best type of anesthetic I can have? So what are the different types of anesthesia you can give an orthopedic patient, for example?
I mean, not only just orthopedic surgery, I believe in any surgical specialty, there are few standard techniques. One is general anesthesia, which most of them are aware of, that will put them to sleep, and will put a breathing tube when they are completely under sleep.
Yeah.
We make sure they are not aware of anything that's happening inside the operating room theater. And so that's called general anesthesia. And the other thing is spinal anesthesia. Spinal anesthesia is something that we don't put needles inside the spinal cord. That's what most of the people are scared of. Like, you're going to put a needle on my back. I'm like, no. There are few spaces, few layers before we even go to near the spinal cord. So we just put a needle, give some numbing medication close to those layers, so that makes you numb all the way from waist down level.
Right.
So for all the surgeries that we do, most of the lower limb surgeries, as you notice, so waist down there, they usually don't
Right.
feel anything. So also preparing them for that. Because all of a sudden, when you feel like, you're not able to move your legs, they feel scared. I mean, this is job that we do every day, but for them, it's the first time experience. So again, prepping them, letting them know and telling them what to anticipate, and psychologically preparing them is going to help and take the patient a long way. That experience will be little more blissful than being scared and not knowing what's going to happen next. So that preparation, I think, helps them a lot.
I think the needle, even though people think that you're going to go into the spinal cord, in fact, spinal cord ends at the lower end of L1. Below that is only the nerves. So you don't have to be worried that the needle is going into the spinal cord.
Yes.
It goes through the spinal column to the CSF. Once you see the CSF, you're
exactly
taking it out, right?
As you rightly mentioned, the level at which we do, the spinal cord already
lower.
ends. So that's a spinal anesthesia. And there is another layer, back injection technique is epidural anesthesia. We usually go for epidural anesthesia when we feel like it's a longer procedures, because we can put a small plastic catheter. It's similar to what labor woman gets for pain control. Exactly the same procedure. But when we are, anticipating long duration of the surgeries, because spinal is a single shot technique, max we can get like, even if we use other medications, 4 hours at the max that we can get it, even if you add little bit of adjuncts to it. Epidural is something that gives us time when we think that it takes longer time. And the recent techniques that we are using is regional blocks. So which is very, very, very happening nowadays. Regional blocks are something that, suppose if you're operating on the upper limb and this area, so I don't have to put you for general anesthesia. I don't have to give anesthesia for the entire body. And it's not the lower limb, it's upper limb. So I cannot go for back injections. That's not going to help. So what we do is, using an ultrasound, we look at the nerves that supply that particular body, either it's upper limb or lower limbs, or so even for abdomen also, few procedures we can do it, abdominal blocks also. So we look with an ultrasound, carefully locate the nerves that supply that particular area, give some numbing medication around those nerves. So for a period of 6 to 8 hours, basically that numbs that area. So either you can give surgical anesthesia, that means the surgeries also can be performed, or in few scenarios where we have to put them to sleep and then give nerve blocks, so that in that scenario it helps with pain control. Even intraoperatively, postoperatively, until they recover, so that it's a very effective pain management.